We have an important health alert for you this morning, and I want you to take a look at something. It's a dangerous fungal infection that is spreading across the country right now, and it attacks the eyes. It can even blind. And the 38 million Americans who wear contact lenses should be particularly cautious about this.
I came home from work one day and I knew something was really wrong.
Allison Bregman Rodriguez has felt pain before, but never as intense as when she took her contacts out 4 months ago.
The pain was excruciating. I felt like lightning was in and out of my eye.
Turns out Allison had an eye infection caused by a fungus called Fusarium. Infections are on the rise, a mystery that started in Asia, and now U.S. doctors are reporting dozens of cases here.
Just in the last 3 months, we have seen over 20 patients with this type of infection.
In the past, most eye doctors would see just 1 or 2 cases a year, and almost never in people who wear contact lenses. But now nearly half the victims are contact wearers.
We're puzzled. We don't know why some patients are getting the infection and other patients are not.
The fungus grows within the cornea, the transparent window covering the eye. But if the infection isn't treated with antifungal drugs quickly, the fungus can cause permanent eye damage, even blindness.
I lost my vision for about a month, and that was the most horrifying experience I've ever had.
Allison regained her eyesight, but her eyes will never be the same. She has permanent scarring and vows never to wear contacts again.
Glasses are my best friend.
And we're joined this morning by one of the country's top experts on this infection. Dr. Arthur Epstein is an optometrist who chairs the contact lens and cornea section of the American Optometric Association, and he joins us from Phoenix, Arizona this morning. Dr. Epstein, I appreciate you being here. I always thought or understood that the eye, while it's obviously a very sensitive organ, was very strongly resistant to infection, particularly fungal infections.
Absolutely so. That's the conundrum and the real issue we face. We don't understand why these otherwise normal, healthy patients are suddenly develop these infections. We'd never seen them before, and certainly the numbers are unprecedented.
And while the numbers of cases still are relatively small, they are growing, and I gather have people, optometrists, rather alarmed.
Certainly, there's good reason for caution. I think it's important to keep in mind that it's still a very, very small percentage of patients. Contact lenses are safe. They're an effective form of vision correction. And patients, while having the need to be cautious, certainly don't need to be afraid.
Do we know how it's spreading?
We don't really know how it's spreading. We know that there are certain factors that are related. For example, poor hygiene, non-compliance with contact lens regimens, and certainly that gives us insight into ways we can minimize risk for patients. But there are other factors that are currently under investigation by the U.S. CDC, the Food and Drug Administration, and various groups.
Now, I mentioned that about half the number of cases are contact lens wearers. Do we know if the people who are contracting this, who do wear lenses, that it is some way connected to the fact that they wear lenses?
Only insofar as the number of patients who wear lenses would typically represent a fraction of overall fungal keratitis cases. And now we see that this is a much larger group, much different demographic, a much younger group, much healthier group, no history of trauma or any of the other predisposing factors. So that's why we're so concerned. We need to get a grip on this, we need to understand this, and we need to do it quickly.
And because it's rare, I understand most doctors are not particularly prepared or know how to test for it, and most pharmacies don't stock the kind of antifungal drugs used to treat it.
That's true, and in fact, it's one of the reasons that I'm here. It's very easily confused with bacterial keratitis, which is still rare, but a more common form of infection with contact lenses. And because fungal keratitis is so unusual, it's easy to mistake for bacterial conjunctivitis and easy to mistreat, and they do sometimes have to go out of their way to get the appropriate medications.
And what should people do to ensure that they don't contract this?
Well, the patient's best friend is common sense and good hygiene. Number one, they should always wash their hands before they handle contact lenses. Number two, they should clean their lenses as directed by their optometrist. Number three, they should rinse their cases and dry them before using them again. Cases should be replaced every 3 months. And finally, if they have any issues or any problems, they should consult an eye doctor immediately. One other tip I think that's very important important is that patients sometimes top up solutions. They should never do that. The disinfectant is used up in the disinfection process, and they end up with ineffective disinfection, and that can grow bacteria and fungi.
All right. Dr. Epstein, appreciate you being with us. Good health alert. Thanks.
The American Optometric Association thanks you for allowing us to share this important information with the public. Thank you, Charlie.
Sure.